you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast, dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Hey guys, welcome to GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Cynthia, and happy Wednesday, everyone. I hope you all are having a fabulous day. I hope you all are just crushing the week so far. I am feeling super snuggly, super warm right now. I bought this really cute sweatsuit over the summertime because we all know when things are out of season, or not out of season, but when they're not in season, it tends to be cheaper, right? So buying winter clothes in the summer, everything's discounted. And during the summer, there was all of my favorite brands, or most of them, were having all of these sales, trying to get rid of their winter clothes. And this one specific brand were discounted their sweatsuits, and they're like low-key expensive, and they discounted them by almost 50% off, and they're so cute, so comfy. I was like, I absolutely need it. So I've been saving this sweatsuit that I'm wearing since like June, and I've been waiting for it to get cold, and I've been waiting and waiting and waiting. I thought, okay, maybe September. Nope, not September. I said, okay, maybe October. Nope, not October. And finally, today, November 11th. It is nice and cold here in the Sacramento area, so it is appropriate for me to wear this super snuggly sweatsuit. It's just plain black, nothing crazy or too exciting happening here. But I'm so comfortable. It's so warm. It's been like so cold here in the Sacramento area, and I know I sound like a baby, especially for those who live like in actual cold areas like Alaska or like, I don't know, somewhere in the Midwest. I know as Californians, we complain a lot about the weather. But when you're used to 75 degrees and perfect almost every day, yeah, we're going to complain whether it's too hot or too cold. So anyway, enough about my sweatsuit. Oh, one more thing, okay? And I always say that like I'm in a really good mood today because of this, but like there's always something to be in a good mood about, I feel like. Like there's never a day where I go about and I'm like, there's nothing I shouldn't be happy about today. Like that's just not my thought process. But anyway, before I get on this whole other tangent, today, November 11th, marks my official 1 year that I've been doing the thing, okay? I've been recording these episodes for you guys, talking all things health and wellness, and I am just so blown away by the support I've received, as well as just blown away by the fact that a year has already passed by. Like how? That's insane. Time really does fly by as you age, and it's just really crazy because when I first, stepped into the studio and was told, you're going to be doing episodes by yourself, I was frightened, y'all. Frightened. Okay. Like I know what I need to talk about. I love to talk, but I don't know. The thought of me like talking on my own for almost an hour frightened me so much. And here I am a year later doing it weekly by myself. I'm just really proud and amazed by my own growth. And again, I have all of you to thank because y'all keep listening and tuning in to what I have to say. So thank you, thank you, thank you. And again, Happy 1 year to me. So all the fluff is out the way now. Let's get into what we're really here to talk about, okay? I'm going to need all my ladies up in here to listen up. I'm going to need all the men with daughters or nieces they take care of, or just anyone you love, any woman you love in your life, to listen up to what I have to say, okay? Because we're going to be discussing all the health tests every woman needs and should have, okay? Staying healthy is not the most difficult thing you'll ever do, but it does take some effort and vigilance, okay? We have to stay on top of these things. Like, health is wealth, y'all, right? Like, I say this so many times because I truly believe that without health, you really have nothing else. Like, if you are feeling crappy, you can't go to work. You can't properly, take care of the kids. You can't properly take care of the house. You can't properly take care of the business, of your responsibilities, right? Like, you can't even take care of yourself. Like, it is so important that everyone's health is at the forefront of their minds, okay? Especially with this pandemic that we've been in for, I don't know how long now. It's literally been months. Your health is your wealth, y'all. So put effort into it. Be very vigilant and be on top of those doctor appointments, of those health screenings and tests that you need to do, woman and man. But on today's episode, we're going to be dedicating it all to women's health. But again, that shouldn't deter my fellas out there to pause this episode and listen to something else. No. Because I'm sure there's stuff in here that can benefit your wife, your sister, your niece, your auntie, some woman in your life, okay? One part of that effort is getting appropriate screening tests, right? Which are used to detect potential health problems when they're still treatable. That's really the biggest thing. It's all about preventative care. And the screening tests you'll need will change as you age. So once you start a test, it will likely be required periodically for the rest of your life. Yes, for the rest of your life. So here's some tests you need in your 20s and 30s, okay? So for all my ladies that are in my age group, 20s and 30s, listen up. The first is the pelvic exam and pap smear. Regardless of your sexual history, okay, women aged 21 and older should have a pap smear every 3 years. The pap smear looks for signs of cervical cancer. And your doctor may let you have pap smears more infrequently after 3 consecutive normal pap tests. This interval can also be extended in older women with a negative HPV test. Women should also be tested for sexually transmitted diseases, STIs, sexually transmitted infections, based on individual risk factors and age recommendations, okay? So I want to just really emphasize that no matter your sexual history, okay, by the age 21, ladies, you should start getting these pap smears done. I remember when I actually was not on top of my stuff, and I didn't get my first pap smear until I'm hella putting my business out there. I didn't get my first one done until I was 22. So 22 was my first one. And I remember I told my mom about the test. Mind you, I come from very traditional Mexican background, okay? At least that's how I grew up. And when I told my mom this, she immediately flipped out, you don't need to get that done. Yada, yada, yada. You only need to get that done if you've had sex, yada, yada, yada. And I'm like, Mom, it doesn't matter if you've had sex or not. You need to get the pap smear done. It's for cervical cancer, okay? Looking for those signs. So she's good now, but I feel like all my ladies and fellas out there who grew up in a strict traditional Mexican household, you gonna feel me on that one, right? Other people aren't really gonna understand outside of a culture why they react that way, but it makes sense within our community. So again, ladies, that's the first one that you should be getting done in your 20s and 30s. And also another really, really important screening that must be done within this age group is screening for breast cancer. Yes. Breast cancer screening consists of clinical exams and screening mammograms. If you have family members with breast cancer, your doctor will screen you to see if you're at risk for more dangerous types of breast cancer that are linked to certain genes. If you're at risk, your doctor may recommend genetic counseling or BRCA testing. So you guys, we're going to cut into a very brief break. And when we come back, more on the importance of screening for breast cancer.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
What's up, you guys? Welcome back to GSMC Health and Wellness Podcast. So right before the break, I told you guys that once you hit your 20s and 30s, this is when you should start self-examining and start screening for breast cancer for some possible symptoms, right, and catching it early on. So I want to dedicate a little more time onto breast cancer screening. As we know, it's unfortunately really common. So I think it's really important for me to dedicate a little more time on dissecting this issue a little bit and really getting into greater detail of what is a breast cancer screening. So breast cancer screening, ladies, means checking your breasts for cancer before there are signs or symptoms of the disease. And all women need to be informed by their healthcare provider about the best screening options for them. When you are told about the benefits and risks of screening and decide with your healthcare provider whether screening is right for you, and if so, when to have it, this is called informed and shared decision making. Although breast cancer screening cannot prevent breast cancer, it can help find breast cancer early when it is easier to treat. Talk to your doctor about which breast cancer screening tests are right for you and when you should have them. So here are some breast cancer screening recommendations. The United States I can't even speak right now. Let me get it together real quick. The United States Preventive Services Task Force is an organization made up of doctors and disease experts who look at research on the best way to prevent diseases and make recommendations on how doctors can help patients avoid diseases or find them early on. The United States Preventive Services Task Force, also known as USPSTF, recommends that women who are 50 to 70 years old and are at average risk for breast cancer get a mammogram every 2 years. Women who are 40 to 49 years old should talk to their doctor or other healthcare professional about when to start and how often to get a mammogram. Women should weigh the benefits and risks of screening tests when deciding whether to begin getting mammograms before age 50. So here are a few ways you guys can get breast cancer screening tests, okay? A mammogram, I think that is one of the more common ones and that we hear of. A mammogram is an X-ray of the breast. For many women, mammograms are the best way to find breast cancer early, when it is easier to treat and before it is big enough to feel or cause symptoms. Having regular mammograms can lower the risk of dying from breast cancer. And at this time, a mammogram is the best way to find breast cancer for most women. So I think a common question people may have regarding mammograms and breast cancer screening is, where can I go to get screened, right? And the answer is, according to the CDC, you can get screened for breast cancer at a clinic, hospital, or a doctor's office. If you want to be screened for breast cancer, call your doctor's office, and they can help you schedule an appointment. Most health insurance plans are required to recover screening mammograms every 1 to 2 years for women beginning at age 40 with no out-of-pocket costs, like a copay, deductible, or co-insurance. Okay? Just a quick FYI for you ladies who are wondering, listening to this episode. Another type of breast cancer screening test is the breast magnetic resonance imaging, aka MRI. A breast MRI uses magnets and radio waves to take pictures of the breasts. MRI is used along with mammograms to screen women who are at high risk for getting breast cancer. Because breast MRIs may appear abnormal even when there is no cancer, they are not used for women at average risk. Here are some other exams. There's a clinical breast exam. So a clinical breast exam is an examination by a doctor or nurse who uses his or her hands to feel for lumps or other changes. Then there's a breast self-awareness. Being familiar with how your breasts look and feel can help you notice symptoms such as lumps, pain, or changes in size that may be of concern. And these can include changes found during a breast self-exam. You should report any changes that you notice to your doctor or healthcare provider. Having a clinical breast exam or doing a breast self-exam has not been found to lower the risk of dying from breast cancer. Now, with all of that being said, there are some benefits and risks of screening. So let's get into that. Every screening test has benefits and risks, which is why it's important to talk to your doctor before getting any screening test like a mammogram. Okay? So the benefit of screening is that finding cancer early when it's easier to treat. Now, here's the risks of screening. Harms can include false positive test results. When a doctor sees something that looks like cancer but is not. This can lead to more tests, which can be expensive, invasive, time-consuming, and just cause anxiety, okay? And trust me, I know all about this because your girl deals with it on the daily. So we don't need any of that, but it is a possibility. Tests can also lead to overdiagnosis when doctors find a cancer that would not have gone on to cause symptoms or problems, or even may go away on its own. Treatment of these cancers is called overtreatment. And overtreatment can include treatments recommended for breast cancer, such as surgery or radiation therapy. These can cause unnecessary and unwanted side effects. Other potential harms from breast cancer screening include pain during the procedure and radiation exposure from the mammogram test itself. While the amount of radiation in a mammogram is small, there may be risks with having repeated x-rays. And mammograms may also miss some cancers called false negative test results, which may delay finding a cancer and getting treatment. So those are some of the risks with screening. I feel those are risks you get with any type of health screening you may endure. So I think it's just nice to kind of refresh your guys' mind on those very, very common possibilities that could happen. So again, that in a nutshell, very quick nutshell, is about the breast cancer screening. We just barely touch the surface. We can really get into greater detail about that. But I think I'll dedicate another episode just to breast cancer and breast cancer awareness and more detail on that, because there are so many other tests that us women need to be on top of. That is just one. Another one that we need to be on top of, and this goes for both men and women, is the physical exam, right? So like the general physical exam. And you should have 2 physicals during your 20s. At each exam, your doctor should perform a careful head-to-toe assessment and check your height, your weight, your BMI, which is your body mass index. Your doctor may also ask you questions about depression, alcohol and drug use, smoking, diet and exercise, vaccination history, intimate partner violence, all of those like very private topics, right? And in this age group, you should also begin your cholesterol test. So women aged 20 and older should get a baseline screening for cholesterol levels and triglycerides if they're at risk for coronary heart disease. The American Heart Association recommends women get checked every 4 to 6 years, starting at age 20. After age 45, screening for cholesterol becomes important as heart disease risk increases with age. So you guys, we're going to cut into a very brief break. And when we come back, more on health screenings for 20 and 30-year-olds.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Hey guys, welcome back to GSMC Health and Wellness Podcast. So like I said in the previous segment, that was just all about breast cancer health screening. And just think of this episode as a reminder, right? A reminder of all of these tests that we need to get done in order for us to stay healthy and in order for us to just go about our day-to-day lives comfortably, pain-free. I think that's one of the biggest blessings, right? Just your health, staying healthy, not having any major pain or injury or any chronic health condition. So that is something that I'm always, very, very thankful for when I wake up. And anyway, let's get back to our regularly scheduled program here. So we wrapped up about cholesterol test. Moving on to blood pressure screening. A diagnosis of hypertension or high blood pressure is made if your blood pressure is higher than 140/90. Because high blood pressure can lead to other complications, it should be checked every 2 years if it's 120, 80, or under. If it's higher, your doctor may recommend having it checked more often. If you are diagnosed with high blood pressure, you should also be screened for diabetes and eye exam. Get vision screenings every other year if you wear contacts or glasses. If you don't have vision problems, screening may not be necessary. However, you should see an eye doctor if you have any concerns. I'm going to be totally honest here, y'all. I, for the life of me, can't remember the last time I went to see an optometrist for an eye exam. I am very lucky. I want to say perfect, okay, like perfect vision. You know, I wake up in the morning. First thing in the morning, I don't need to grab my glasses or put on my contacts to see. That is something that I was taking for granted for a while until both of my siblings, they both wear my sister wears contacts, my brother wears glasses, and they both were like, do you know how lucky you are? You can just wake up and see. And I'm like, dang, well, I thought like everyone could see, really. Like, I didn't think it was to the point like where people who are wearing contacts or glasses like literally can't see when they wake up. So I am super, super grateful for my vision. And, you know, luckily I have really great vision. So I haven't really prompted myself to go see an optometrist to get these eye exams. And I'm like, I feel like I'm doing okay. What I do wear blue light blocking glasses. I'm actually wearing them right now because I'm in front of 2 screens, and one of them is huge. It's a huge monitor that's like 10 inches away from my face. So definitely blue light glasses, whether you have perfect vision or not, is a necessity. The blue light glasses, you know, they block the harmful blue rays that radiate from our screens, you know, from our phone, from our laptop to TVs. We're just constantly looking at screens, right? Even in our cars, like most cars now, newer models, have a screen there, you know, Bluetooth, GPS, all of that stuff. So blue light blocking glasses really is a necessity. That's part of the eye care, I'd say, because blue light, too much of it is very, very harmful. And getting blue light blocking glasses is part of putting in that effort towards your health, right? That's how I view it. I'm like, this is part of the effort. So anyway, I know I kind of went on like a weird tangent about eye exams. So dental exam, of course, is another one we need to regularly get checked. You should visit a dentist every year for an exam and cleaning. And then moving on to immunizations. You should get a flu vaccine every year, especially if you're over the age of 65 or have risk factors that make you more susceptible to infection. You should get 1 tetanus diphtheria booster every 10 years, starting sometime after age 19. If you're younger than 26, you should consider the HPV vaccine. If you have never had chickenpox, you should get the varicella vaccine. That's mainly for the age groups of 20 to 30. Of course, if you're over the age, that doesn't mean you should not be getting these health screenings or health tests. This is just kind of like when you should begin doing this, right? When you should start really getting these health screenings in order. So now moving on into tests you need in your 40s to 60s. The tests you began in your 20s will still be used in your 40s, okay? So that won't stop. Though the timing of the exams will change. You should have an eye exam every 2 years, even if you don't wear glasses. You should have physical exams every 1 to 5 years. You should get a professional breast exam every year. And then consider getting a shingles vaccine after the age of 60. You'll also need several new tests starting in your 40s. So again, the first is the mammogram, which we went through. All women should have a mammography to screen for breast cancer. How often you seek treatment varies by age. The U.S. Preventive Services Task Force recommends mammograms every other year for women between 50 and 74 years old. Women younger than age 50 should work with their doctors to determine how often to have a mammography. For women over age 75, there is no recommendation because not enough research has been done on the impacts of mammography on women in this age group. Breast exams. Starting in your 40s, your healthcare provider will perform yearly breast exams. They will visually and manually check your breasts for differences in size or shape, rashes and dimpling, and lumps. They may also check to see if your nipples produce fluid when gently squeezed. I know I'm getting really graphic here. I know some of you are probably cringing in your seats with me just saying nipple and squeeze, okay? You should be aware of how your breasts look and feel and report any changes to your physician, okay? So actually, I know I said we're done talking about breast, exams and screenings, but we're not. I want to get into the breast self-exam. So what is a breast self-exam? A breast self-exam is a screening technique you can do at home to check for breast lumps. A breast self-exam can help screen for tumors, cysts, and other abnormalities in the breast. A breast self-exam was once thought to be a good screening process to breast cancer. Now, a self-exam is considered to be less effective than other techniques, such as regular mammograms. And this has led groups such as the American Cancer Society to deem breast self-exams optional, okay? So you could still do it, but you still want to get those mammograms done. Breast self-exams help you familiarize yourself with the shape, size, and texture of your breasts. And this is important because it can help you determine if what you're feeling is normal or abnormal, right? Nobody knows your body better than you, not even your doctors. Anytime you feel an abnormality in your breast, tell your healthcare provider. So you guys, we're going to cut into a very brief break right now. And when we come back, we're going to get into more detail on how to prepare for a breast self-exam and how to perform a breast self-exam. We'll be right back.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
What's up, y'all? Welcome back to GSMC Health and Wellness Podcast. Right now, we're going to get into how to prepare for a breast self-exam and how to perform one. I know I'm dedicating a huge chunk of time right now to this topic, but again, I think it's just so important. So again, to prepare, the best time to do a breast self-exam is a few days after your monthly menstrual cycle ends, okay? Hormonal changes can affect the size and feel of your breasts, so it's best to perform the exam when your breasts are in their normal state. Women who don't menstruate should choose a certain day to perform the exam, such as the first day of each month. You should also keep a journal of your self-exams, and this will help you track and record any changes you have noticed in that area. Now, here's exactly how to perform one. Start by standing topless in front of a mirror with your hands at your sides. Visually inspect your breasts for the following: changes in size, shape, or symmetry, dimpling, inverted nipples, puckering, or asymmetrical ridges at the bottom. Check for these signs with your hands at your sides, then with your arms over your head, and again when lifting one breast at a time. Using the pads of your fingers, not the tips, inspect your breasts while lying down and again in the shower. The water and soap in the shower will allow your fingers to glide easily over your skin. Using varying pressure and taking your time, massage your fingers over your breasts in a spiral pattern at the nipple. Make your way up to the top of your breast near the collarbone, to the center by your breastbone, and to the sides near your armpits. Do this by putting one arm over your head while massaging your breast with the other hand. Lastly, gently squeeze your nipples to check for discharge. I just felt a little sick saying that. Bleh. Now, here are some risks of a breast self-exam. There's no, per se, medical risk involved in a self-exam. Finding a lump in your breast can be alarming, but a majority, actually, of breast lumps aren't malignant or cancerous. They're typically caused by other benign conditions. Breast self-exams have also been associated with an increase in unnecessary breast biopsies, which are procedures that involve the surgical removal of breast tissue. And because most abnormalities in breast tissue are non-cancerous, the extra surgical procedures put women at risk for rare complications such as bleeding and infection. After a breast self-exam, if you find a lump or abnormality, don't panic. Remember that the vast majority of breast abnormalities turn out to be benign or non-cancerous. Besides cancer, breast lumps can be caused by fibroadenoma, which is a benign tumor of the breast tissue, fibrocystic breast disease, which is painful, lumpy breasts caused by hormone changes, intraductal papilloma, which is a small benign tumor of the milk ducts, mammary fat necrosis, which refers to lumps formed by bruised, dead, or injured fat tissue. And this doesn't mean that you should ignore a lump or abnormality. If you find a lump, make an appointment with your healthcare provider to have your breast professionally examined. So again, that is how you perform and prepare for a breast self-exam. So again, moving on to more health tests and screenings that 40-year-olds all the way through 60s should continue to do. Next is colon cancer screening. Once you turn 50, you should start being screened for colon cancer. Possible tests include a yearly stool test, flexible sigmoidoscopy every 5 years, colonoscopy, which is every 10 years, double construct barium enema, which is every 5 years, computed tomographic colonoscopy every 5 years. You may need screening more often if you're at high risk of colon cancer, and you should be screened for this until age 75. Next are skin checks. According to the American Cancer Society, about 3.3 million Americans are diagnosed with skin cancer each year. To catch it early, check yourself once a month, starting at age 18, by looking for new or suspicious moles. Screenings by a medical professional are based on a patient's risk factors. These risk factors may include significant sun exposure, family history of skin cancer, fair skin, the presence of multiple unusual moles, and a history of several blistering sunburns, especially early in life. So that was from 40 through 60s. Here is tests you need after age 65. Timing for screening tests continues to change as you grow older. For example, your blood pressure should now be checked yearly. Your cholesterol should be checked every 3 to 5 years or more often if it's abnormal. First thing you need to do after age 65 is bone density test. Women age 65 and older should be screened for osteoporosis. If you have ever had a fracture, you should have a bone density test once you go through menopause. And you should also have the test if you're under 65 and have high fracture risk. Also a hearing test known as an audiogram. And an audiogram is a check of your hearing at various pitches and intensity levels. You may need one once a year. And then a pneumonia vaccine. This is a series of 2 vaccines administered a year apart. It is recommended that people over age 65 get vaccinated against pneumonia. And other tests you may need. Based on your health, your doctor may order other screening tests to supplement the standard age-based tests. And then depression screening. The National Alliance on Mental Illness estimates that 16 million American adults had at least one major depressive episode in the last year. They add that women are 70% more likely than men to experience depression. If you're concerned about your mood, ask your doctor for this screening. Your doctor will ask questions about symptoms such as sleep troubles, irritability, loss of libido or sexual interest, sluggishness, loss of interest in unusual activities. And then a diabetes test. If you are at high risk of diabetes, you may need to be screened for pre-diabetes and diabetes every 3 years starting in your 40s. If your blood pressure is over 135/80 or you have high cholesterol levels, your doctor may screen you for type 2 diabetes. Diabetes risk factors include physical inactivity, severe obesity, having a first-degree relative with diabetes, or being of African American, Mexican, American Indian, Native Hawaiian, Pacific Islander, or Asian. And a lot of it's contributed to the foods we eat. We all know that we have the best food, right? As far as the Black community, the Latino community, the Native Hawaiians, Asians, and so forth. But they're not the healthiest, unfortunately. So I'm not surprised that these groups are among some of the most high risk for diabetes. I mean, it's what we're fed literally day in and day out, 3 times a day, possibly even 4. So it really doesn't shock me at all. So you guys, we're going to cut into a very, very brief break right now. And when we come back, more here at the GSMC Health and Wellness Podcast.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Hey guys, welcome back to GSMC Health and Wellness Podcast. We are now entering the final segment of today's show, and we're going to end it with discussing the physical side of stress and how it can affect your emotional and physical health and how to cope, especially for women. According to the American Academy of Family Physicians, stress is an expression of the body's natural instinct to protect itself. While the stress response may warn us of immediate danger, like a fast approaching car, prolonged stress can negatively affect your physical and emotional health. Our stress response was exquisitely honed over millions of years as a protective mechanism, says Paul J. Roche, chairman of the American Institute of Stress and a clinical professor of medicine at New York Medical College in Valhalla. That was okay for our ancestors who ran into saber-toothed tigers. The tragedy is that today, it's not that, but hundreds of things like getting stuck in traffic jams, and our bodies respond in the same unfortunate fashion with hypertension, strokes, and ulcers. So how does stress affect a woman's mind and body specifically? While men and women can react similarly in many situations, stressful or otherwise, there does seem to be some difference in how men and women react to stress. While the exact mechanisms aren't clear and findings are conflicting, some research suggests that differences in the brain and body may make women more physically and emotionally sensitive to certain types of stress. Women tend to react to stress differently than men, says Dr. Roche. They don't respond with the fight or flight response. They're more apt to negotiate. In previous research, psychologists have called this the tend and befriend response. This may have come about, theorized scientists, because it would have been evolutionarily adapted for women to protect offspring rather than attack or flee from predators. The tend and befriend response, some think, may be mediated by oxytocin, an anti-stress hormone produced in women during childbirth, breastfeeding, and in both sexes during orgasm and other moments of human connection. This hormone may help women more than men, according to Roche. Studies have shown that frequent hugs from a partner can increase levels of oxytocin and lower levels of blood pressure in women. Research has also found that women who have positive contact with a partner before a stressful situation show lower levels of the stress hormone cortisol and lower heart rates. So how does stress affect a woman's health? The particular challenges that women face at home, in society, and at work may increase the amount of stress you experience. Your stress may vary, but if you have stress with your work, your kids, your neighbors, and marriage all at once, that's a big deal, says Lori Heim, past president and chair of the American Academy of Family Physicians and a physician at Scotland Memorial Hospital in Laurinburg, North Carolina. In women, I see this in changes in menstrual patterns. Nothing else is going on except a huge increase in stress, and all of a sudden, they may be losing their hair or having menstrual irregularities, and everything points to stress as a factor. According to the National Women's Health Information Center, the effects of stress on women's physical and emotional health can range from headaches to stomach trouble to back pain. Specific stress effects include stomach ailments. Stress can make you reach for junk or comfort foods or upset your stomach to the point that you feel like you can't eat. Common stress-related stomach troubles include cramps, bloating, heartburn, and according to a study published in November 2017 in the journal Frontiers in System Neuroscience, even irritable bowel syndrome, IBS, which affects more women than men, depending on how you respond, these can lead to weight loss or weight gain. Skin reactions. Stress can lead to breakouts and even itchy rashes and hives in some people. Emotional conditions. From being in a blue or irritable mood to more serious mental issues like depression, your emotional health suffers when there's stress in your life. Sleep problems. Trouble falling or staying asleep is common in women affected by stress. And this is particularly counterproductive since a good night's sleep can help ease stress. And difficulty concentrating. Stress makes it hard to focus and be effective in your responsibilities at home or work. And that can compound your problems if the stress comes from your job to begin with. Heart trouble. Stress can negatively affect the entire cardiovascular system, and while it doesn't directly cause high blood pressure, stroke, and heart attack, it can definitely contribute to them. Lowered immune response. One of the more complicated physical reactions to stress is your body's lessened ability to fight off disease, whether it's a cold or a flare-up of a chronic condition. So with all of that being said, how can women lower stress levels? In a survey of 3,000 people, Dr. Robert Epstein, a senior research psychologist at the American Institute for Behavioral Research and Technology in Vista, California, found that 25% of happiness hinges on how well you handle stress. And what was the most important stress management strategy he noticed? Planning, or anticipating what's going to stress you out, right? And having the tools in place to tamp down the tension. Here are some more tips for managing stress. Improving your diet. By eating well-balanced meals and skipping junk food, you can improve your physical well-being and, in turn, your emotional health. So make time for exercise. We do know that exercise is a phenomenal way of dealing with stress and depression. Research shows that getting active can lift your spirits by increasing hormones and neurochemicals that can improve your mood. Find fun ways to relax. Connect with family and friends and people you enjoy being around. Rediscover favorite hobbies. Research published in 2013 in the journal Frontiers of Psychiatry has linked pursuits that require focus, like crafting, drawing, or even home repairs, with stress-reducing effects. Other popular stress busters include yoga, meditation, and Tai Chi. Finally, if you feel overwhelmed by stress and its effects, talk to your doctor about ways to deal with it. You may learn new techniques for managing stress on your own, or you may find that therapy with a mental health professional will better help you to get it all under control. So you guys, that's it for today. That's going to wrap up today's episode here at the GSMC Health and Wellness Podcast. I really hope you all enjoyed today's episode and found the information very valuable. Again, whether you're man, woman, or whatever you identify with, I'm sure somebody in your life can benefit from the information that was shared on today's episode. If you guys enjoyed today's episode, please don't forget to like, share, subscribe, comment, all of that stuff, because that tremendously helps the show. And I'll catch you guys here for the next one.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.